at the incidence of mental health conditions in terms of its how common it is highly prevalent. And the problem is that if you do not treat it in the GP sector, there's not enough specialists to actually deal with it, and actually specialists should only deal with really treatment-resistant cases that need specialist care. And often medical schemes sell various options. You have the top options that often pay for these treatments, but then you have the bottom schemes that don't, especially for the antidepressants, because they're not part of the PMB. Now you get 15 outpatient psychotherapy sessions to be done by a psychologist or a psychiatrist if it's needed, but you do not often get the medicines on your benefit, and that is a problem because then you have to pay for it. Although some of them are very cheap, it's not necessarily the only ones that might work. So that is a problem. But I think the schemes also view that maybe GPs can't treat it quite successfully and therefore don't give them any benefits. But I think we need to rectify the problem. That's one way of solving it, but obviously that's not a solution. So we need to get GPs upskilled to treat it and benefits in line with patients being treated. Because we think there's more than a third of patients at any given time with a psychiatric condition walking around. So, they have to be treated by general practitioners.
Let me first say it is much better than it's been. So there's improvement, but unfortunately there is still particular medical schemes or funders that the funding is not enough. And what has been good in South Africa is that there's prescribed benefit conditions like depression that needs to be treated, and funds would be available irrespective of what plan you're on. But South Africa do have a huge burden also with anxiety, for example, and that's not necessarily covered. So there's actually a huge proportion of patients or potential patients out there that desperately need help, but they're not able to get the help they need unless they're on a very good plan. And usually the very good plans do have enough benefits to manage that.